Hi, I'm Dr. Antigone Vesey.
And I'm Dr. Ashley Dewar.
And we are putting on a clinical reasoning course for temporomandibular joint dysfunction. We're getting together today to give you some background on why we decided to do this and hopefully inspire more clinicians to take on this clinical journey. So I think a great place to start is how you found me and how your experience and mentorship shaped your passion for what is something a lot of physical therapists and athletic trainers are afraid of doing.
Yeah, no, I think the jaw is definitely kind of the black sheep or the kind of forgotten child that we stay away from it because we don't feel like we've actually become proficient in it. I mean, it depends on the setting that you go into. I knew from the start that ortho is where my heart lied, and I had a lot of great clinical experiences and mentorship through various CIs that I had. But coming to this clinic, I really feel that how we were mentored and how deep we dove into things really kind of shaped my better understanding for the joint itself and for treatments and physical therapy treatment for TMJD. I think that it's something a lot of us have a similar story of. In PT school. We had, 1 hour, 3 hours of a lecture talking about the jaw. So when that patient come in the clinic, you're like, well, shoot, I actually have to treat this now, and I'm going to hope it's coming from the neck because I know how to treat the neck, but I have no idea what I'm feeling for when I go inside of the mouth. So I think really the depth at which we go into examining the jaw and how I was mentored in that way, as well as the clinical reasoning piece of realizing that the jaw can come from the neck, it can come from the jaw, but there's other pieces to it. And these patients that have been told your popping, clicking is normal, that'll never go away, or your pain is just something you have to deal with, sorry, there's nothing we can do for it. And finding that with the way we've been able to take current literature and knowledge about the jaw and shape it into how we now treat it and give them even better outcomes is something that I definitely think sets us apart.
I agree, and the research would agree with you that physical therapy programs are very inconsistent in how they treat the jaw. Sometimes it's a supplemental lecture, sometimes they dive really deep, so that is a competency challenge. And then even when you look at survey data of residencies and fellowship, it's still across the board. And honestly, you and I have had the opportunity to speak to dentists and to collaborate with dentists. We have like 50 dentists that refer to us and we talk to, and we've seen their schools of thought and who they treat and their methodology, and they're all over the place. And they'll admit it, that in their education, sometimes they haven't had any lectures or a supplemental lecture or a variety of clinical education on this topic. They've had to seek that post-professionally, and our world is exactly the same. So I think there's a need for that. And personally, my journey with it has been to help this patient. Like, this patient has spent a lot of money. This patient has seen every different person because we all treat it like a supplemental thing, right? We've seen ENTs working with us. We've seen psychologists. We've seen pulmonologists, sleep specialists. We've seen, obviously, dentists, orthodontists, and a variety of their specialists. And all of these professions are like touching on it from their lens, but nobody's putting the pieces together. So I think what you and I have done these last 4 years we worked together is really shape what is the reasoning behind the care, who needs to be in place and when, and how do we work as a team in a medical system that has its own challenges.
No, I totally agree. I think the team collaboration is the biggest thing. I think especially in the world of physical therapy. And even as a new grad or somebody newer in the field, you think that I need to stay in my lane, I can't ask questions, I need to respect. And we all show levels of respect to each other in general, but you don't feel that you have the knowledge or the background to maybe question or ask for further information for different treatments from other providers, because we are, sometimes we're just seen just as PTs, right? But for these patients, I mean, having that continuity of care across all specialties and knowing that you're close with the dentist, you're close with the periodontist, you're close with the oral surgeon, whomever they are, so that we can actually create that holistic plan of care for these patients and not just say, I can only do my one thing, you can do so much more than that one thing if you're all kind of working together.
100%. And we talk about this in the course, but is the jaw the culprit or the victim? And how great we are at treating the culprit. If it's the victim, how we might be a management strategy, but we can be a means to provide the care to refer them to the person who can help. And as we've developed these relationships, we've seen such interesting people. When I first started out and I was in the beginning, it was always the chronic pain person. But now that we've had these relationships and we're collaborating, like you just alluded to, we're seeing the acute I bit a steak yesterday and my bite is off today. We're seeing the professional singer who has the pain when they're hitting the high note. We've seen the adolescent who has congenital deformities that needed operative care and we're treating them. And so seeing this wide array of patients has given us such an opportunity to teach this and put this information in some perspective for other professionals.
No, absolutely. I think that at the end of the day, most of our patients, unfortunately, have been told it's because you're stressed, it's because you have poor coping mechanisms. This, again, is something that we just can never get rid of. Or they're told it's because you are female, or because you have anxiety, or because you clench at night, and there's no hope for that. But as PTs, we like to be the ones that are known to be the one that fixed it. And kind of alluding to your point is we may not be the one actually that needs to fix it, but we can at least have the knowledge and we can have the understanding of where to help them go and guide them throughout all of these different specialties to ensure that they do get the results that they're looking for.
Yeah, we get more time with them. So building that therapeutic alliance trust, especially when it's your mouth and your face. I mean, it's a really scary joint when it's not going well, or you can't eat, or you can't like kiss your partner. I mean, those things really affect you. And so when we come in and we have someone that's like, hey, I was able to, make out with my partner, you're like, yeah, let's go. Or I know you had the patient who like went on to Italy and ate a bunch of food that they weren't otherwise able to eat. And it's super rewarding. I tell people I did not become a PT to be an expert in this joint. I mean, I didn't, but these patients have touched my heart and nobody has been their advocate. And now that I can collaborate with professionals and we have the people who love this like us and we geek out about it. And we have the professionals who are like, I don't want to touch it. I want to send them all to you. And that's fine too. This is not for everybody. Going into someone's mouth is not for everybody. But I think the world owes these patients more answers.
Absolutely. And I think, for me personally, I don't like it. I don't want to touch it. When I first started, I would literally scream when you would put a jaw eval on my caseload. And I was like, I want nothing to do with this. But that didn't come from, I don't want to help them. It was, I don't feel like I can help them. I'm not the right person to help them. I don't have that understanding. And that's where I think this course will shine, because it goes beyond how do you examine, how do you evaluate the jaw. It's how, as a PT, can you treat it, and maybe treat it a little bit more specifically to what's in front of you, because you have a deeper understanding of what's going on. But also, again, to maybe we don't need to treat that. Maybe we're treating something else, but referring them to somebody else for what they actually need. But being able to recognize that. What are they saying? What are they feeling? What have they experienced that makes you think, oh, this isn't actually really a PT thing. This is a somebody else thing. And we're going to work together to make sure you get what you want and what you're looking for in life.
Totally. The clinical reasoning is everything with this patient. I think we have some skills, and a lot of the PT and athletic training courses out there that are teaching the jaw show you skills like, here's a hammer, here's how it works, here's a screw, here's how it works. And they go, okay, go treat your patients. And these patients come in the door and they are so variable that you're like, I got tools, but I don't know how to build a house here. Or who should I be contracting to come in and help me with this? And so this course is about the reasoning. We will go over the skills. We will make sure that you can do those things, but when to use the hammer, when to use the screw, how to think about the blueprint before you start trying to fix things so that you feel confident that you're not going to flare someone up or make things worse. And then who to bring in so that it's the most efficient, effective process for that patient is where it's at. And I think once people can experience what we're offering, they're going to go into the clinic next day with the tools, because we're going to hand them to them, and they're going to be able to start to treat this patient with confidence.
Absolutely. And the next piece is too, I think that takes it the next step further is, how many courses have you gone to, or like, I get it, I got it, that's great, this is awesome. And then you get that patient in front of you and you're like, oh crap, that totally didn't go exactly I thought it was going to go, and I don't know why. Is also the piece of, we give you all these tools and you'll have all these skills now in your pocket, but if you still have that patient that you're not quite sure what to do about, you have a question or something didn't happen the way you expected it to, we're also offering to be a mentor still there and somebody that they can reach out to in order to still have those clinical conversations and talk those scenarios and figure out what could have been done differently. Because, mentorship is something that everybody should have access to and should be a lifelong thing. You should never feel like I'm the expert and I'm done and I no longer need to do anything else with that. We always have more to learn from each other. So having that resource of this new connection and this new community of people that are treating the jaw and trying to do the best they can every day with the jaw, we can always be a support system for each other.
I'm glad you brought that up, because we know there's skill decay if you stop using it. And people do leave those courses. They feel like they've refreshed their skills, but then they can't apply it. So not only are we going to teach you the skills, not only are we going to physically give you the tools to do it, but we are going to give you the opportunity to come to office hours to present your case, so that when you're struggling and you have a pain point, it's not, okay, I give up. It's, I'm going to go have a resource. And I think that's what's going to set this apart too.
Absolutely. Totally agree.
Yeah. Well, I'm grateful that you are on this journey with me, because it's been a journey, and I'm really excited to get what we created out there.
Me too. Could not agree more.